Welcome to the American Holistic Nurses Credentialing Corporation Conversation Corners. Our next subject is cultural and holistic considerations for Hispanic Latin population living with a cancer diagnosis. Our speakers are Dr. Grissel Hernandez and Dr. Quilvio Rodriguez. Dr. Hernandez's healthcare career spans over 30 years, from social work, public health, and nursing in direct care to education and leadership roles in community health and magnet designated organizations. As executive director, magnet program director at Stanford Healthcare, she leads nursing workforce development, professional growth, and Watson Caring Science integration initiatives. Dr. Hernandez is nationally board certified as a holistic nurse and in nursing professional development. She is a Caritas coach and Watson Caring Science postdoctoral scholar. She was inducted as a Global Academy of Holistic Nursing Scholar in 2021. She's president-elect for Watson Caring Science Institute and Stanford Medicine's Alpha Alpha Lambda at-large Sigma chapter. Dr. Quilvio Rodriguez graduated from Miami-Dade College's Associate Nursing Program, the Pacific College of Oriental Medicine's Holistic Nursing Baccalaureate Program, and he received his MSN and DNP from Columbia University. He's a baccalaureate board-certified holistic nurse. He has worked as a psychiatric nurse in New York City's public health system over the past 4 years. As a nurse, he has worked for the Office of People with Developmental Disabilities in a group home setting, Elmhurst Hospital's Adult Detox Substance Abuse Inpatient Unit, and Harlem Hospital's Adult Inpatient Behavioral Health Unit. He has trained in holistic nursing, acupressure, healing touch, cognitive behavioral therapy, hypnosis, aromatherapy, yoga, meditation, and mindfulness through various institutions. He was recognized as a scholar in the National Health Service Corps in 2018. This conversation aims to create a safe space for exploring the cultural and holistic considerations of the patient's lived experience in receiving a cancer diagnosis, undergoing treatments, and survivorship. The primary focus is on the experience of Hispanic Latin patients as they navigate healthcare decisions, family dynamics, language barriers, and existential distress. The goal is to facilitate healing through finding meaning in the patient experience and strengthening connections using Newman Health as expanding consciousness and Watson Caring Science theories as the foundation for holistic care delivery. AHNCC would like to welcome Dr. Grissel Hernandez and Dr. Quilvio Rodriguez.
Everyone. Hi, welcome everyone. Thank you for coming to our presentation today on the cultural and holistic considerations for Hispanic, Latina populations living with cancer. I am Quilvio Rodriguez. I am a psychiatric mental health nurse practitioner at Herbert Irving Cancer Center, which is affiliated with Columbia University, and I'm also an adjunct faculty for the family psychotherapy practicum. Grissel, would you like to introduce yourself?
Sure. Hello, everyone. My name is Grissel Hernandez. I am the Executive Director for Education, Professional Development, and the Magnet Program Director at Stanford Healthcare, and as recent as last month became the Interim Associate Chief Nurse for Research. I am also a Caritas coach and a board certified holistic nurse.
Excellent. To start off, I'm doing a bit of a social experiment / meditation. It's going to be held in Spanish. For people that don't speak Spanish, I want you to join us in this Spanish meditation and then share your thoughts on how it went hearing a meditation in a different language. I'm going to make the sound ding to begin and ding to end. And Grissel, don't criticize my Spanish. Ding. Respira profundamente. Deja que el aire salga de tu cuerpo. Bienvenidos a tu tiempo de paz. Este es tu tiempo puesto al lado a traer paz a tu ser, paz a tu mente, cuerpo y espíritu, creando una intención de ponerte más relajado, más calmado. Tu cuerpo se recuerda la manera naturalmente a estar quieto y tranquilo. Enfocándote en la respiración, imagínate cuando el aire entra a tu cuerpo, trae aventuras y nuevas experiencias. Y cuando el aire sale de tu cuerpo, estás dejando atrás todo lo que no te sirve en este momento. Déjalo atrás. Y el ritmo de la respiración, el sube y baja del pecho con cada respiración, son como unas olas en el mar. Hasta te puedes imaginar caminando en una playa, mirando estas olas que suben y bajan con cada respiración. Arena suave abajo de tus pies, la temperatura está perfecta y los rayos de sol sobre tu piel son como un abrazo de una persona que te ama mucho. Dale una mirada a este lugar una vez más, tu playa de paz, sabiendo que puedes regresar cuando necesitas. Para terminar la meditación te recuerdo de estas palabras. En este momento, amor divino sana mi mente, cuerpo y espíritu. Hoy me rindo a la posibilidad de sanación completa. Yo nací con muchos regalos y me recuerdo dárselo a las personas importantes de mi vida. En este momento, amor divino sana mi mente, cuerpo y espíritu. Y puedo descansar en las manos de amor. Ding! Welcome back. This is an example of one of the meditations I use with my patients. I see someone with their hand raised. Any reflections, thoughts on this social experiment / meditation?
Anna, did you have, oh, I'm sorry, Ellen, go ahead.
I didn't understand the Spanish, but I definitely picked up the calming energy that was coming through.
Yeah, excellent, Ellen. And that's kind of part of the theme that I was going with this experiment. Caroline?
Hi, Quilvio and Grissel. It was very interesting because just as you started, Quilvio, I mean, I'm sitting in New York City, but just as you started, I immediately moved south. Like my being was somewhere between, I'm from South Texas, and it was sort of in the region of South Texas and Mexico. And it was such an interesting shift of just feeling in a different geography. So thank you for that.
Excellent.
I like thinking of the sand as a hug from a person who loves you very much. I like that image a lot. Thank you.
Yeah, I just want to share. I do understand Spanish. And so at first I had my eyes open And then as soon as I closed my eyes, I immediately was transported into an ocean, seeing waves, and then getting the hug from a person loving me back. Just beautiful. So thank you so much for that. It has so much more flavor in Spanish.
Sabor.
Thank you. And we're going to proceed, but I did this social experiment because I wanted to kind of plant the seed that we have the power of intention and we have the power of presence, even if we don't have the language. As providers, we are not gifted with the ability to speak all the different languages, but we do use translator services or interpretation services, as it's better indicated. Uh, but our patients still hear our voice, still see how we come into the room, still see how we interact with them and even the interpreters that are there. Therefore, the power of presence and the power of intention, you bring it with you regardless of what language you speak. And that's kind of what I was trying to kind of implant, those kind of holistic ideas and concepts. Any reflection on that before I proceed?
Well, Q, I couldn't understand obviously the translation, unfortunately, but I rode the wave. It was very trance-inducing and very relaxing, as Ellen said. And I had to come back, which was hard because I had to admit people. I didn't want anybody to miss it. But I think it was a really good social experiment because I think it reminds us that we have a shared common language. And it's important that we use the tools that we have because we can connect with people even if we don't speak their language.
Excellent.
Um, Marcy
Bonnie?
Marcy has a comment that you might want to read it. I'll read it. The meditation felt like calm, fluid poetry. Even though I couldn't understand any of it except the deep breaths, it felt really caring and loving.
Thanks for the comment. Bonnie?
I just loved the vibe and the tone. And for me, since I teach meditation and imagery to so many different kinds of cultures and all that, it's the energy. It's the energy that's being evoked. And sound is energy. And that's an essential piece of it. And it's universal. The energy is universal. And that's how we can all embrace it. So I totally deeply appreciate what you're representing. Thank you.
Well, thank you. Thank you. I'm really glad to hear. I'm going to go ahead and share the screen as we move along with the PowerPoint part.
You have one more hand.
One more hand? Okay, excellent. Go ahead.
I just saw it in the chat room.
Hi, I'll be
Jalissa.
Hi, thank you. I'm just glad to be in this space with you all. That was a beautiful meditation piece. And I've taken like 4 years of Spanish and I've lost it along the way. So I was able to pick up a few words and I'm trying to get better at it. So thank you for allowing this space today.
Excellent. I'm going to share the screen. And even though we're doing a PowerPoint, I still want to continue this kind of idea of this being more of a conversation place. Less academic kind of in a classroom stuff. So feel free to interrupt a little bit as we go along. So this is just the beginning slide, the cultural and holistic considerations. And I want you to be mindful that cancer affects people of all ages and affects people across ethnicities, races, financial structure. And the pain and the suffering is universal and part of the human condition. And therefore, I'm going to provide some demographic data that indicates the inequalities. It is complex, but just kind of indicating that that is something to think about, that it's kind of in the background, okay? So here's kind of the agenda. Someone was going to speak.
I was gonna ask if you can go to slideshow and up at the
Okay.
top. And so you,
How do I do the slideshow? Here?
yes, and then go from this slide, from current slide.
Okay, and then what happens there?
It's supposed to, give you the full, just the screen.
Okay. We'll work out the technical difficulties another time. I don't know why my
Okay,
brain can't process that
go
right
ahead.
now. We're gonna do we did the meditation. We talk about some demographics and using translation services. So let's go with the demographic from the American Cancer Society. They provide kind of epidemiological data every 3 years. So the data here is from 2021. They're currently working on 2024. And what they estimated is that there's approximately 61 million Hispanic and Latinx people in the United States. They don't delineate between Hispanic and Latin American. They just put Latin American and Hispanic populations together. Technically, Hispanic populations come from the Caribbean, that being Cuba, the Dominican Republic, Puerto Rico, and therefore Latin America is more in the continent part of the Americas. But either way, that's how they identify the population as Hispanic. I believe that there's more than this population because there's many people that are not counted via census data and different immigration status, but that's kind of the rough estimate of what they have found. And what they indicated, there's an estimated over 176,000 new cases of cancer in the Hispanic population per year and over 46,000 deaths per year. And they compare the rest of the part in the slide is in comparison to non-Hispanic whites. They only use that as a point of comparison because in their data, non-Hispanic whites tend to be most insured, have better treatment outcomes, and early detection for a variety of cancers. But once again, there are outliers. We know that there are many health disparities among non-Hispanic whites in rural communities throughout the US. So, but just using that as a comparison tool. And they indicated that the highest rates of financial toxicity was in this racial and ethnic group, where there's unmet healthcare needs, meaning they are uninsured or underinsured. And then the ones that are insured have a healthcare unaffordability, difficulty paying their copay or paying that hospital bill at the end of their treatment. And there's also a general financial stress. So these three different kind of factors together, they've identified as financial toxicity. And this is a group in the US that has the highest rate of financial toxicity. Also, Hispanic individuals have a higher rates of infection-related cancers, including approximately twofold higher incidence of liver and stomach cancer. When they say twofold, that means a 2 times the amount found in non-Hispanic whites. Also of note, cervical cancer incidence is 32% higher among Hispanic women in the continental US and Hawaii, and 78% higher among women in Puerto Rico. All this to say, there is a lot of health disparities. This is a complex topic, but I just wanted to set the stage and make some recommendations for early referral for social work and assistive services case management. Evidence-based strategies for decreasing the cancer burden among Hispanic population include the use of culturally appropriate lay health advisors, patient navigators, and targeted community-based interventions, programs to facilitate access to screening and promote healthy behaviors. That's a big information-heavy slide. But what I want you to grasp from it is that this is a vulnerable population that may have a lot of socioeconomic needs outside of their immediate medical needs when getting a cancer diagnosis. I'll just give a brief moment to kind of reflect on this before we proceed. Any thoughts on that? I'm going to share my screen again. We're good? I'm going to do it this way. It's just a little bit easier for me. I don't know why I can't do this. Can you still see?
Yes.
Okay. All right. Go. Any comments?
Can you hear me? This is Rhonda.
Hi, Rhonda.
I'm having trouble hearing. It's not you, it's on my end. You were talking about toxicity. What was the terminology that you used? And can you expand on that a little bit?
So the term is financial toxicity.
Okay.
And that is a term that encompasses three different factors. The first is an unmet healthcare need, indicating they either have poor access to services, meaning the hospital or doctor is many miles away and they can't either get to it physically, or this can also deal with insurance of being uninsured, not having health insurance. Then there's the healthcare affordability. They may have insurance, but they have a difficulty paying for co-pays or the portion after a hospital bill that the patient is responsible for. And then the last part is the general financial stress. This can be from their own expenses, childcare, housing, etc. So those three things together are capitalized in this term called financial toxicity.
Okay. Thank you for clarifying that. That's a new terminology for me.
I know it's kind of things are evolving, and yeah. So we're going to continue. Working in the Cancer Center, I'm just giving you a little brief introduction to a large topic of psychosocial support. And when you think about a cancer diagnosis, uh, typically we get a lot of people referred to us during the initial diagnosis because it's a very scary time to receive this diagnosis. And a lot of emotions are going through people's minds and their bodies. Also, initial diagnosis, that's the beginning of treatment. It tends to be the best time to introduce patients to coping strategies, let them know that our services are available when they need us, things like that. Because once they get into active treatment, kind of the second phase, they may be very sick, tired, fatigued, etc., and overwhelmed to the point that they don't even know how to ask for help or even receive help because they're in a very difficult place, either undergoing chemotherapy, radiation, or surgical intervention. And then there's survivorship. Sometimes people are just running through their cancer journey and they just go to my appointments, trying to stay positive, trying to be active in my care, taking care of my body, that they don't have the time to process emotionally what happened. And it's after they beat the cancer diagnosis, they're cancer free, that they're like, whoa, that was a big chunk of my life that year or those 2 years. And they might seek psychosocial support afterwards to process that traumatic event. So that can happen then. There's also palliative care when we're dealing with either end of life or some cancers that don't have a cure or definitive treatment, or if there's a recurrence and end of life. So therefore, basically at any moment, if you can recognize emotional, psychological decline in a patient that has a cancer diagnosis, I would recommend for you to refer for psychosocial support. And just because someone is living cancer free doesn't mean that they are not emotionally affected by what occurred. The typical evidence-based treatment approaches are acceptance and commitment therapy, ACT, where you accept the things that are out of your control, and then you look at your values and create committed action to do things according to your values. And there's also meaning-centered psychotherapy. But I'm from the holistic side of things. So I'm thinking of nursing theorists, Margaret Newman, and caring sciences, which we'll discuss later. But they have similar themes to these psychotherapeutic approaches. And also from a med management perspective, using psychotropics for chemo radiation side effects, such as nausea, fatigue, neuropathy, scan anxiety, also treating depression and anxiety. So kind of being proactive, because for a patient to get through their cancer journey more successfully, treating the emotional aspects of their condition or the treatment effects may help them tolerate the treatments better. Thoughts, feedback on this? All right, I will proceed. Next up is using interpretation services and holistic considerations. Once again, the power of intention. Nurses engage in a purposeful act of setting an intention prior to care delivery. What is your purpose? What is your role? Why are you going into that room? And kind of grounding yourself, having that intention in your mind before these interactions can be really helpful. The power of presence, which can be defined as a way of being with your client. For example, eye contact with the patient, not the interpreter. You're speaking directly to the patient. Therefore, sometimes in interpreter and translation services, the provider or the nurse looks at the interpreter translator, and then it's like a phone tag type of thing. But even though you're speaking English, my recommendation would be to still look directly in the eyes of the patient as you're speaking to them. And that tone of your voice, speaking from the heart, softly, gently, and with care. Also, keeping the message simple to ease translation and patient understanding. Reduce medical jargon and complex phrases when appropriate. Sometimes you have to actually name the organ that's going to be operated on, or explain a procedure that may be a little bit more technical. And the translation services, interpretation services should be able to guide you through it, but at the same time, kind of keeping the message simple, because instead of saying, we're gonna do neoadjuvant chemotherapy to reduce tumor burden, then following up with a partial hysterectomy. The patient's gonna be like, wait a minute, I don't understand all these complex terms. Maybe saying, we'll provide you with chemotherapy before your surgery, before we remove a portion of your ovaries or etc. But kind of simplifying the message can make the translation and interpretation services a little bit easier and kind of going through. Also, avoid family member interpretation when possible. This is a tough one because the family really wants to be involved, but we cannot rely on that family member to provide adequate interpretation services. And there also may be family dynamics where the full message, or maybe a simpler, calmer version of the message, is interpreted. You would like the full message of the nurse or the provider to be provided to the patient. Does that make sense? What I'm trying to say is a little complex, what I'm trying to say, but does that make sense?
Sure does.
And I can attest to being a 7 and 8-year-old, going with my parents to the medical offices and being their interpreter. And let's just say I got a head start on anatomy and physiology, because I barely knew what a liver was, but I was expected to interpret what that was at 7 or 8 years old because there wasn't really interpreter services at the facility. And in some ways, that kind of difficulty and challenge planted a seed in my brain that we need more Spanish speaking providers. And it encouraged me to become a provider later on. But that's my way of kind of navigating the health disparities. If you want to change something, get in it and change it from within, kind of thing. Now we proceed with Grissel, who's going to share her experience. Hey, Grissel.
Hello. And here, I can bring up my 2 slides.
Beautiful, beautiful. Because, as you
No
can tell, I'm
worries.
having a problem with technology.
I'm probably not gonna be any better than you, but just bear with me, everybody.
Oh, I love the way you do it, how I can still see you.
Hold on. Let me just switch. Can you see my screen?
Yes.
Yes.
Perfect. So I actually thank you very much for giving me the opportunity to be here with you today. And before I get started, I too add to my resume medical interpretation as a child because I also had to do that for my parents when we moved from Puerto Rico to New Jersey, and I needed to go with my parents to their doctors until they were able to find Spanish-speaking physicians, but for the majority of the time, they were obviously English-speaking. And I wanted, I'm excited to be able to share with all of you my own family cancer journey. Not that I should be excited about having such a history or journey. However, when I was listening to Q's statistics, I could relate to several of those statistics. The fact that I have family members who have died of stomach cancer. Both of my paternal grandparents within months of each other. My grandmother dying of lung cancer, my maternal grandmother, and my paternal grandfather survived colon cancer. And but I want to focus a little bit on my immediate family and my own experience with a cancer diagnosis. I come from a little bit about me and my family. I come from a family of social activists, artists, storytellers, and healers. And I grew up with a very deep appreciation and connection to the spirit world, nature, and traditional healing practices, which there's a reason why I'm telling you this. Of course, from a gigantic Puerto Rican family, I was born in Puerto Rico, and so my brother and I were born in Puerto Rico, and we grew up in New Jersey. And however, we brought with us our Puerto Rican core cultural values, authenticity, respect, compassion, humility, and service. And our family, every conversation that we had, and probably because of that deep connection to the spirit world, we could be talking about politics, or we could be talking about religion, and somehow, talking about angels, or talking about how everything that happened to us, there was a reason for it. There's inspiration and purpose. Finding on everything that happened was big in our family. And in fact, I remember the way that we learned to pray from my parents was you randomly open your Bible and the answer is there. Or you would pray, and prayer was an invocation. It meant that the moment it left your lips, the answer was going to somehow show up. So I grew up with these beliefs, and I think that kind of had an impact on the kind of profession that I was going to get myself into. So I became a social worker, and then nursing found me. And along with nursing founding me, it also I became very I realized that Watson Caring Science really resonated with me because of those cultural values, and because that was the kind of nurse that or healthcare provider that I wanted to be. And so it became or it has become foundational to my personal and professional life. And there's a reason why I'm telling you this. If you look at these pictures that I have here, this is my father. My father's name was Victor. And this is me at 3 years old. And I was daddy's little girl. I had him for the first 5 years of my life before my brother was born. And here's my little brother right here, and here he is older. My father died of pancreatic cancer. As a matter of fact, 19 years ago this week. He was 61 years old. And the way that he handled his cancer diagnosis was in a very private way. He never wanted, first of all, the first time he found out that he had a cancer diagnosis was when we entered the oncologist's office. He thought that he had pancreatitis. The doctors never told him that there was anything else other than that. He never told anybody that he was in pain. He thought that the way that he could handle his pain was by prayer and running. My father was an athlete, and the pain was not going away, and he lost a lot of weight. I lived in New Jersey at the time, and he was in Puerto Rico. He called me and he told me that, I'm in the hospital. My aunt happened to be coming to visit us in in New Jersey, and I asked him to send me all his films, because I was going to have a doctor in the hospital where I work to look at them. And I shared them with the radiologist, and he basically told me, you need to sit down. And I knew before my father that he had pancreatic cancer, but I couldn't tell him. I went to Puerto Rico, and I went with him to the oncologist. And the first time that he looked at me, I remember entering into going to the office and kind of seeing oncology, written on with the name of the doctor. And he looked at me, and all I could do was just hold his hand, and it was very difficult for me because at that particular moment in time, I wanted to stop being a daughter and I wanted to be a nurse. And I wanted to ask all these questions, right? Because I needed my dad to have the best care that he could possibly get. He got his diagnosis there. He was silent. His wife at the time, he had remarried, and she was silent. My dad had an opportunity I still remember him asking the doctor, how much time do I have? And the doctor was very compassionate with my dad and said, it was stage 4 at the time, basically explained to him that he was going to have palliative chemotherapy, and it could be maybe 6 months, perhaps, but maybe longer, one or the other. Don't focus on that time. Just focus on the quality of your life, etc. My father could have had chemotherapy and all of those services, that we talk about, social worker, all those things. He could have had that literally 15 minutes from his house. He chose to drive or to have somebody drive him an hour away. I don't know if you're familiar with Puerto Rico. We actually live in the mountains, and we have to go through a lot of curves to get to the place where he needed to go and have his chemotherapy. And I remember asking him, why are you doing that? My goodness, you have, you're 15 minutes away, you can have everything that you need. And I realized that the reason he was doing that was because that doctor looked just like me. She was a replica of Grissel, and he felt comfortable with her because it reminded him of me. My father died 6 months later, to the day. No, he didn't want anybody to know that he had cancer. He thought that it was a punishment of some sort. Now I want to introduce you to this woman right here. This is my mother, Iris, Carmen Iris. My mom died 6 years ago, this month as well. And she died of sepsis in the hospital. But my mother was a 4-time cancer survivor. My mother had thyroid cancer, she had breast cancer, she had colon cancer, and she had uterine cancer. And contrary to my, different from my father, she made sure that everybody and their mother knew that she had cancer. And she had deep faith, and she always, and she was very Catholic. And I remember her saying to me, I believe in God, and I'm Catholic. However, I just want to make sure that I cover all the bases. So if you happen to have any Jewish friends, if you have any Muslim friends, if you have, she went through the list, just make sure that they put me in their prayer circles, because I want to make sure that I cover everything on that end. She really wanted, she also thought that all these different cancer diagnoses, there was a deeper meaning for her. And she was not afraid of letting people know that she was sick. We lived in New Jersey when all this happened, and I had to go with her to doctor's appointments. And there were a couple of times when she almost had wrong medication given to her because of lack of interpreter services. There was an instance when she was called, I still remember, and it was Friday. You need to come here because you need to have this chemotherapy, this medication that you need to take. And so we are flying on the New Jersey Turnpike to go and talk to the doctor, and basically to realize that they had the wrong chart on her. It was the same name. It was the same birthday, except for the last number on the year. She was 1945, and this person had a 1946. And she was the one who caught it. And she was concerned about this other person. She's like, how are we going to make sure that she's going to have her medication? But she almost ended up taking medication that wasn't hers. So I realized that I needed to be her advocate. At the time, I I had just completed my nursing degree, and I was working in an OBGYN clinic, and realized how important it was that there was somebody there with her at all times that could be her advocate. I remember also how scared she was of her going to the hospital, because every single time she went to the hospital, something was wrong, right? And she, every time they said to her that she was going to go and have surgery at X hospital, she will freak out, because every time she went to that particular hospital, bad things happen. So needing to really support her to help her with those things were important. She was also big in traditional healing practices. So she had a pharmacy, if you will, in her backyard, herbs and use of aromatherapies and everything that I will give to her, because I was a holistic nurse. And I remember every time she had to go for surgery, I remember when she had her thyroidectomy, and then had to have iodine therapy, and she had to stay in the hospital for a long time. She requested a priest to come and give her her last rites, and she was upset because she couldn't take communion, and that was important to her. So the spiritual care, needing to explain to her that it was okay that she didn't have communion that day, that he was going to pray with her. And then having to be so far away, when you get radiation therapy for your thyroid, they keep you, isolated because of the iodine therapy, and the radioactive iodine. And that was such a shock to her, because she thought that she was dirty, and to accuse Point needing to explain the rationale behind the different chemotherapy treatments is important, because and to listen to their concerns, because otherwise she wanted to go home. Well, can I just take the pill and just stay in my room? No, you can't do that, Mom. You really need to stay here. And having to explain those things to her was important. And then there's me. Here I am in my quinceañera dress, which is a big deal for any Hispanic girl that ever lived. Oops, sorry about that. Except for me, I only did it because of my I only did it because my mom wanted me to do it. So we had a faux quinceañera. Just the pictures. My father died in 2005. And 3 years later, I received my own cancer diagnosis. I was at work. I was having a lot of epigastric pain that was radiating. And I thought that it was stress. And my office was really close to the emergency room. And I remember going to the emergency room, talking to the manager and the clinical nurse specialist in the emergency room. And I told them what was happening. And they're like, "Oh, how old are you, Grissel?" So I told them I'm 38. And they're like, "Well, maybe you're having a gallbladder attack or whatever." Right? But I'm like, okay, well, they put me through triage, and they did a CT scan. And the doctor called me right away and said, we need to have an MRI. And 2 days later, I was told that I had kidney cancer. I wish that I could tell you that I, immediately answer all, had all these questions that I needed to answer, I needed to ask and things like that. And that I was like the most put together patient. But if you have ever had a cancer diagnosis, it doesn't matter how much education you have. The moment you hear cancer, you literally freeze and your head goes blank. And I remember telling my husband, okay, here's a list of questions that I need you to ask the doctor when we go and talk to him. And he's like, why? And I said, because I am not going to be able to talk about it. So I need somebody with a clear head to really answer and ask these questions, because you need to take notes, because I literally just went into a giant blank. Once I went to my, I talked to the doctor and they sent me to a second opinion, and it was the same thing. Now it's time to, what are we going to do? Right. And I think this is where caring science for me kind of took hold. I basically realized, okay, Grissel, now you have an opportunity to really put into practice all these things that you've been teaching these nurses about. And it wasn't until I until I was a patient that I basically called that my nursing school. I have to tell you that when I became a patient, I understood what it is that patients need from me as a nurse. And I became a better nurse because of it. So, going back to that inspiration and purpose, by no stretch of, by no means am I saying that I got cancer so that, I could learn these things. However, I was able to find purpose and meaning in the experience that I was going in, and I could understand where my parents were going through and why my father kept things in his heart. And perhaps one of the many reasons why, he really lasted only 6 months. I understood why my mom told everybody and their mother that she had it, because that was important to her. And those were the things that really anchored her. So I was grateful for the opportunity to really put into practice, not only from a personal perspective, but also from a practice perspective, the tenets of Watson Caring Science. And here are, for those of you who are not familiar, or for those of you who are familiar, here are the 10 Carita processes. And I understood what it meant to practice loving kindness, because it gave me an opportunity. I actually decided, when I was told that I had cancer, I was told that I needed to have surgery. And then after that, then they were going to decide whether or not I was going to have additional chemotherapy or radiation or whatever it was. This was 2008. I was 38 years old. And I made a decision that I needed to prepare myself, not only physically, also spiritually and emotionally, for what was coming. Because I knew that when I told my parents that my mom and my stepdad and the rest of my family what was happening, that I probably needed to be there for them as well. So I remember telling my mom, and she was very upset. The words that came out of her mouth were, "I am sorry that I passed to you such crappy genes." I remember her saying to me. And I said, "Mom, it has nothing to do with you. Well, maybe, perhaps, but no time to be worrying about that right now." you know. But I knew that because she was reliving her own cancer diagnosis. She was in Puerto Rico at the time because they had moved to Puerto Rico the year before. So she came. So now I needed to worry about her and basically half of my family that decided to come and stay in the hospital with me. And so I understood what practicing loving kindness meant, because I needed to have grace with myself so that I could have grace with others around me. I went from moments of I can handle this to why me. I I felt unworthy of all the people who were trying to help me. Because I'm the fixer. I'm the one who should be helping you, not the other way around. So it was very difficult for me to ask for help. Um, I I understood what it meant to be authentically present. And I can tell you this because I lived it. I could tell when staff were not their hearts were not in the right place. I could feel the energy of the people who were entering my space in the hospital. I could tell when they were worried about other things. Nobody knew that I was a nurse. When people asked me in the hospital who I was, I just told them that I was a teacher, which was not a lie because I was in nursing education. So nobody knew that I was a nurse. And I could tell, and I can tell you that even my mom wanted a pastor to come and spend and pray for me. And I was okay, that was important to her. And I said, the more the merrier. But even the pastor was not in the right place. And even though this person came with good intentions to pray for me, I could I could sense the not so awesome energy emanating from her. So and I didn't feel right after that person left. And I can tell you that the most caring, the most peaceful, and the person who created the most beautiful caring moment for me in the hospital was the janitor that was working the evening shift, that came to the room totally apologetic because he needed to empty the trash. And he saw that I was in distress. And without skipping a beat, he knew that I was about to throw up. And he basically, brought the bucket, put it right in front of me, and he held my head while I was basically puking my brains out. And he kept saying to me, "You're going to be okay. I am sorry that you're going through this, but you're not alone. You're going to be okay. And I'm going to go and get the nurse." Mind you, that I had been pressing the button for about 15 minutes and none of the nurses had come to take care of me, but I understood what was happening with the nurses. I knew that they were busy, but and he apologized because he was buffing the floor and it was very loud and everything. And he came back to check on me. And at that moment, I understood what it meant to be authentically present to another human being. And it didn't have to come from somebody with a title. And that was important to me. And I also engaged in different modalities to take care of myself and became very much in tune with the spiritual practices that I needed to have at the time. So meditation and prayer were important to me. Also, journaling. But I realized that journaling to me was not, I could not get into it. So the only way that I could process my feelings were through drawings. So I started drawing things. I also named my tumor. I decided that I needed to become this tumor was a part of me, and I needed to find ways to say goodbye, to honor it and to say goodbye to it. And my mother used to call me her black pearl. And I said to her, why do you call me your black pearl? And she said, because black pearls are unique and special, and you are unique and special to me. So I decided to call my tumor Pearl, and I drew Pearl. And if you guys are familiar with how pearls come to being, right? It's an inflammation. It's a irritant, and but then they end up being precious, right? We all wear it all over, pay a lot of money for that. So I call my tumor Pearl, and I talk to Pearl, and I thank Pearl for being a part of me. And I also told her that she needed to get the heck out of my body because I didn't need her anymore. And Pearl left. I was able to 3 months before my surgery, because I decided to wait 3 months before I had surgery. I started doing acupuncture and massages every week because I knew that I needed those things. I went to painting classes, and I also prepare myself, not only physically, but emotionally for the work. And number 5, I'm going to move with number 5, holding space and allowing for expressions of positive and negative feeling. I had a lot of those. I engaged myself in a lot of those, and realized that I wanted to share with everybody what was happening with me. But it was very exhausting to do that, because I felt like I was being a little whiny about it. So I decided to put together a newsletter, and I will give people, updates on everything that was happening to me. So I engage in creative ways of dealing with my diagnosis. And I'm going to stop sharing because I need to see all of your faces. Probably one of the biggest things that I learned about my diagnosis was 2 things, actually. Even though I did not have to have radiation therapy after the surgery, because they were able to take everything out. I have a partial nephrectomy on my right kidney. I realized that just because you're told that you no longer have cancer, you go through the 1-year mark and the 3-year mark and the 5-year mark and the 10-year mark, it still lives with me. So every time I have any kind of pain, you immediately go to, is a tumor. Pearl is back, right? And that is taxing to your body. And so I realized that the things that I did to support me, Pearl was the perfect acronym for it. And I'm going to tell you what Pearl stands for. Pearl became an acronym for the things that I needed as a patient to help me, especially myself as a holistic nurse and the daughter of people who had gone through this experience as well. And I realized that I needed to learn how to pause. I was the Energizer Bunny. I was always doing, and I never took time to take care of myself, even though I was teaching people to do that because I'm a holistic nurse. I practice within Watson Caring Science, and that is like the number one thing that she teaches you to do, right? But I was the Energizer Bunny all the time, all the time. So I learned to pause. The other thing that I learned was to really to express how I was feeling. I was the kind of person, I was channeling almost my dad. I will keep it to myself, but then I realized that I needed to be more like my mother. I needed to tell people what was happening to me. And that when people asked me what they could do for me, not answer nothing, I'm okay, thank you, but have a laundry list of things that I needed help with. Because as my mom used to say to me, when you don't tell people, when people tell you, is there anything that I can do for you? And you say no, you take their grace away. This is not about you, it's about them. And they are opening their hearts to you. You need to be able to accept that help because that's going to help you. The other one was acceptance. I had a hard time knowing that I had cancer because you immediately start thinking about all the why do I have cancer? Is it my bad genes? Is it did I eat something, whatever it is, and just accepting that diagnosis was critical for me. The other one was rituals. Rituals became very important to me. And rituals were important to my mother. When my mom was sick, um, I share with her nurses that, do you mind if I do Reiki on my mom? And they would kind of looked at me kind of crooked, but I remember saying to them, it's important to her. And they said, okay, you know. And the same thing with me. I remember asking, I did guided imagery. And I remember talking to the head of the anesthesia department at the hospital where I worked. And he was actually a Reiki master. And I shared with him, I'm going to go to the hospital of University of Pennsylvania to have my surgery. And these are the things that I would like to do. And he said, you know what, Grissel, I know the head of anesthesia over there. I'm going to talk to them. So when I talked to the CRNA, I remember giving her a script that I wanted her to use for my guided imagery. Anyway, and they were very open to it, right? And so what is it that you want me to say? And they attach it to my chart, and I came to the surgery and I had my my headset, and they put my label on it so I didn't get lost. And she told me, where do I need to press the button, right? And it was a CD player, I remember. And so anyway, so I was all excited. I'm like, oh my goodness, how progressive is this hospital that they're like, they're really engaging with me on this. And I felt safe around them because they were willing to do this to me. Anyway, now I'm in the room and I'm talking to my mom, and I was actually in surgery for about 5 hours. There were some complications or whatever, recovering. And I finally made it to the room and I'm all groggy or whatever. And, I explaining to my mom, they let me listen to guided imagery. And she's like, oh, okay. So I noticed a bag and I'm like, oh, what's in there? And she's like, these are your belongings. I'm like, okay. And I opened the bag and there is my CD player. And my mom said, well, they gave it to me about 5 minutes after, after you went into the surgery. So basically, they did not do what I told them. I thought that they were going to do, but it didn't matter at that point, right? Because I felt comfortable when they were all willing to do it.
yeah, they lied. But the fact that they listened to me and they were willing to, to listen to the things that were important to me, that felt good to me. So rituals were important to me. And then the last one is laughter. I mean, the day you don't hear me laughing is the day that you probably need to check on me. I find joy in everything, even the hardest things in my life. So that was what I needed as a patient, what I needed as a nurse, and what I basically decided to dedicate my entire life to was, how am I going to teach our nurses, our healthcare professionals, how important they're being, or as Jean says, how can you become a caring, healing environment yourself? I put that in an acronym that I call CARING. I realized that in order for me to be a healing environment as a provider to patients, I needed to have
Grissel,
compassion. Yes.
sorry to interrupt. We won't have time for another acronym, but it seems like there is more time for like another conversation corner. But
Sure.
do you want to just breeze by your acronym and then you can give
Yes.
the stories later? I'm sorry, it's just being mindful of time.
Compassion, awareness, reflection, intentionality, caring for yourselves, and lastly, but not least, an attitude of gratitude. So with that much, I want to say thank you for the opportunity to share with all of you. And sorry that I went too long.
Grissel, you have the time you need. So, we do say that they run around an hour, but you have a few more minutes, certainly, if you need it.
No, that's okay. When I was driving here from work, and I was practicing the presentation in my head, especially after Q told me that, he liked my pictures. I realized that my dad's anniversary is this week. He died October, a month after his birthday, October 10th. And my mother died October 19th. And if I tell you that they both died in the same hospital room, it just, I am lucky to have been born from those two human beings, for all their flaws and for all their gifts. And they instill in me a deep desire and to love everyone around me and to be of service to them. So all the things that I do, everything that I've done, it's because of them. So thank you for the opportunity to share with you today.
Thank you so much, Grissel. That's amazing. I'm not gonna get to my Margaret Newman Health is Expanding Consciousness because I have to expand my way out of this meeting. I have something else going on, but this has been amazing. I'm gonna share I'm gonna send you an email about my thoughts, Grissel. This has been truly amazing to hear, and I'm so glad that you were open and felt comfortable to share with the group. I send positive energy to everyone. I have to jump off, but you can continue and we'll keep going, okay? Thank you, everyone.
Thank you.
Thanks, Q. Were there any questions you have for Grissel? Go ahead, Teresa. You need to take yourself off mute.
Not a question so much as the more I talk to you and I'm around you and learning to know you, I appreciate it.
Thank you.
You're welcome. You just are, full of sharing and love. And I had a little bout with some uterine cancer. They were precancer cells, but then when they sent them to the lab, they decided that we needed to act on them. There were too many, and so they went back and forth as a level 1. But I was fortunate that I didn't have to do chemo. They just took everything out. They did offer to keep things if I wanted to have another child, and this was about 6 years ago, and I'm 71. So I said, no, I don't think we need to do that. And my husband's like, no. So, but to add a little bit of radiation, but yeah, so it is. But I think I must be one of the few people that never really thought about it as cancer, but mine was so low on the totem pole, I guess. They were just pre-cancer cells to begin with. But I've worked with oncology patients, and it's hard, and hospice and those kinds of things, and it's really difficult. So I appreciate your sharing and giving us information to share. I have students now that I share a lot of information, like stories like yours too. So thank you.
Yeah. Thank you, Teresa.
Teresa?
Yeah.
Yeah, Cassandra has her hand next. Grissel, go ahead.
Yes. Hi, Cassandra.
Hi, and thank you so much, Grissel, for your sharing. It's amazing to hear your strength, your resilience, and your innovation. I mean, you use multiple ways to be creative. But my question is, to be honest with you, I am just eager to understand how you came about. I know behaviors, we're expected to name it so we can deal with it. But how did you generate the idea of naming this tumor to deal with it? Where did that come from?
One of the things that I was doing when as a holistic nurse, we get exposed to a lot of different ways of helping our patients, and or books and things like that. And it actually came from the guided imagery work that I was doing. One of the activities on the guided imagery book, and there was a CD, was to basically visualize the disease that you were dealing with or whatever. And around that same time, I don't know if you guys are familiar, or I don't know if you're familiar with Rachel Naomi Ram, I think it's her name. She has a couple of books that came out a long time ago. They're called My Grandfather's Kitchen, and I think it's that one. And there was a story, and basically it's a book about different stories from patients about their experiences with illness. And one of the stories was about how pearls grew up, And so between those two things, I thought, I am a very visual person, and I basically realized that I needed that. Knowing that I had cancer was too abstract for me, that I needed to be able to see what it was. So I still remember with the little newsletter that I put together, I had a picture, I copy and pasted a picture of my radiology, and I did a naming contest with my friends. I said, okay, people, I need to name my tumor because I need to start having conversations, and I'm tired of calling it a tumor. And I got all kinds of names. And then I remember reading that and remembering that my mom called me her black pearl. So there it came. So that's how it happened.
Impressive. Thank you for sharing, Grissel.
Anna had a question.
Yes, that last conversation corner we had was with Kathy Sanchez, and we're highly involved in anti-nuclear movement here in New Mexico because of uranium mining, and we're a sacrifice state, no? So, I'm thinking of Vieques when you're talking about all these cancers, especially your mom's 4 cancers. Vieques really came to mind. I posted an article there about Vieques and how it affects people on the mainland too. So I was wondering if you could address that, Dr. H.
Yeah, so we live really far away from Vieques. We're in the mountains, but I do know that a lot of Puerto Ricans, our incidence of cancer are very high, whether it is environmental or genetics. I don't know, at least for my family. However, I do remember that I'm going to pause there. However, the town where we lived in Puerto Rico, it's called Ay Bonito, is in the mountains. And one of the main industries in that town is one of the Baxter factories that makes the IV fluids and things like that. And there's been some concerns around water contamination from their waste, and also pesticides from just the town kind of trying to keep the vegetation down and things like that. So there's been some concerns, I know, around that. And also there's been some concerns. We're the largest poultry producers in Puerto Rico, and there's been a lot of concerns around the use of antibiotics in the chickens, and also how that particular factory is disposing of waste and things like that. So am I saying that is how come my parents got cancer and I did too? I by no stretch of the imagination am I saying that, but we know that there is an environmental aspect to cancers. I also know that one of the concerns that my oncologist had, especially when they take your family history, the fact that my mom had 4 different kinds of cancer and my dad had pancreatic cancer, they did send me to a genetic counselor so that we could find out if there were any other anything else that we needed to worry about. I do have colonoscopies every 3 years because of the high risk of colon cancer in my family, and every time they do find precancerous tumors and they have to remove them. So I know that that's something else that I need to be worrying about. But yeah, I'm very far away from Vieques, but yeah, I'm pretty sure that the bombing and all that kind of stuff, I know that has been affecting a lot of people.
Are there other questions for Grissel?
I was wondering if you could email me your parents' names so I could put them on our altar for November 2nd for Dia de los
Oh, yes.
Almas.
Víctor José Hernández y Carmen Iris Rivera Pérez.
Can you repeat that?
Gracias. Sure. Víctor José Hernández and Carmen Iris Rivera.
Presente.
Thank you.
So for those of you who don't know, that's the Day of the Dead, and that's when you celebrate your ancestors. So that's what Anna was asking for. There are multiple cultures that do that celebration at this time of the year.
And Puerto Ricans are not we don't do it the same way that Mexican friends do it. However, we do have altars, and they're kept the entire year. And I still have vivid memories of my mom altar with the Virgin Mary and the pictures of all of our dearly departed, so my grandparents. And so now I get to do that. I'm not very religious, but I do find comfort in remembering them every day.
Yep.
And actually, my mom shows up all the time as a white butterfly. So it's fun to see her. Yes, the All Saints Day.
Yeah. Go ahead, Teresa.
Yeah, and often in some celebrations and beliefs, the Halloween really originally is the eve before All Saints Day, but it gets interpreted many different ways in different religions. But I think Romans and Catholics and the Episcopalians celebrate it as the evening before All Saints Day. And
that's one of the things that is probably very important for us as healthcare providers and nurses, to give an opportunity to your patients to share with you not only their feelings about what is happening, right? And also, like Jean says, engaging in all ways of knowing what else is important to you. Because if religion or certain rituals are important to them and that brings them comfort, then let's include that in their plan of care, so that and we get an opportunity to learn more about them, not and not thinking that is weird, but if that brings them comfort and it doesn't jeopardize their health, that's important. I remember taking care of as a holistic nurse, taking care of an African American patient who had she had 4-degree burns on her breast from applying compresses. And she was made feel like she was crazy because she was engaging in traditional healing modalities. And the nurses did not feel that they were compatible with our modern treatments. And she decided to check herself out of the hospital against medical advice, even though she needed to be there, and I still remember her saying to me, "You're the first person who's listening to me," and you get it. I still remember her saying that you get it. And I'm like, there's nothing wrong with you. It's okay for you to do, and it's not or, it's and that's important. And I remember, sharing with the nurses, like, it's important for you to know what are these other things that our patients are doing, because it may not, if we don't include that in their medication assessment or in their treatment assessment, we might end up hurting them because they don't feel comfortable telling us, so they're just going to keep it to themselves, and that can be more harmful. And instead of making them feel that they need to choose between the two, it opens up an opportunity to really talk to them, and just making sure that there's not, especially with medications, right, that there's not medication interactions, or helping them identify other ways that they can incorporate complementary therapies to their treatment plan.
Maybe we should do that as another topic, Grissel. Talking about the different modalities and ways that we bring in culture and religious practices along with pre-Christian ideas and herbs into our therapeutic process.
Yeah.
You have a lot of potential there. And
Yeah.
Carolyn said that she's working on a Dia de los Muertos presentation, which will be interesting. It's a specific celebration for specific cultures. Any other questions for Grissel? I'm looking around the room to see.
Jill, I'm curious to know if anybody could share, and you can either call it out or post it on the chat. If there was anything that you learned today that you will be using in your practice, I'll be curious to know.
I think that I can say, Grissel, just trying to put yourself in the patient's shoes, trying to understand that what that patient is experiencing is not what I'm experiencing. How can I listen to that patient and assist that patient in some way so that they can explain to me so I can listen and then support them?
Yeah.
And I think Carolyn has her hand up. So did you have something to say, Carolyn?
I did, thanks.
Marcy does too.
I just wanted to emphasize, Grissel, and I know Quilvio's gone, but the absolute difference it makes to hear the stories behind the data. And the narrative behind the theory or these principles and things that we come across in our learning. But when you put a name, a story, a family, a face, a child, and that experience, to me, it just makes all the difference. So I appreciate your generosity in telling and sharing your story.
It's amazing what telling your story, allowing your patients to share, their lived experiences. It's therapeutic. Cassandra is one of our nurse scientists at Stanford, and one of the things that we want to do at Stanford is that we want to increase and create a caring science research program, and story theory, narrative theory, narratives are very therapeutic. And we need to add to that, as a holistic nurse and as a PhD prepared nurse, I want to be able to increase the scholarship of these different ways of knowing, because these are simple techniques that our nurses can use to support their patients to augment the modern therapies that we have. We're not asking to replace it. It's an augmentation of that. So thank you for sharing that, Carolyn. Marcy.
Hi, sorry, I'm on my phone, and I'm at work, so I was trying to navigate. So first of all, I want to thank you so much for sharing. I felt like you shared your heart with us. And it was really incredible, and so much of what you shared resonated. One thing that I want to say is that I do this program called Prepare for Surgery, Heal Faster. And with it, I help people, you're nodding, so you know it, where you visualize steps of healing with people. And there are several people who, when I've worked with people with cancers or illnesses, they've named them. And it was important for them to name them and to honor them, to mourn that part that was leaving their body, so that they could have peace and move forward. So what you're saying was actually very important. And I love the name Pearl, because as you said, how pearls come forth as irritants. And one of the things that I took away, and this is something I've always felt was important when, and both you and Q said it, that when you were youngsters and you were the interpreter for your parents, I can't even begin to express how often that has come up when I was a nurse on the floor. And I could, I would take out my phone and I would have an interpreter and I would do all this stuff. And sometimes they wanted the person, and you resonated for me how important it is that it not be a family member, because especially a child, how hard it must be for them to be in that grown-up position, that they really, it is probably a little bit above their knowledge base, and they're doing it because they love their parents, and how challenging that might be for them. But also I've seen it with spouses, where a spouse says, no, they don't need an interpreter. And then, so I may, they understand everything. So I may ask a question and then the spouse is answering and I go, no, I need to hear from, your wife, from your husband. So I have on my own say, I'm really sorry, but I need to stop and get an interpreter. To make sure that, I want to hear from both of you, but it's really important that everyone speaks for themselves. So, and the fact that you both brought that up, it's really resonated with me that it truly is the right way to go.
Yeah, there, and ask, always, we're very prideful, right? And probably happens with everybody. And it's okay to, everybody's gonna say that they don't need, or not everybody, but many people might say that they don't need interpreter services, because they've been here for a long time and they speak English and things like that. And at least what I have done in the past is that obviously I speak Spanish, so but I might not be as fluent, and there are some hospitals that don't even allow Spanish speaking healthcare providers to speak in the language unless you have some kind of certification saying that you have some sort of proficiency, which I'm fine with that, right? And at least for me, what I have done in the past is that I let them know, listen, I understand that you understand. However, I want to make sure that I don't miss anything. I put it on myself. I want to make sure that I don't miss anything, because I understand that for some people, especially if they've been here for a very long time, they might feel that there is, that they don't need, they might not need it, or they're prideful, they have pride in the fact that, they can speak English and whatever. So I always put it on myself. I always say, I just want to make sure that I give you all the information and that I'm clear. And this person is helping me stay clear with my message, because I might be using, big, medical language that might not resonate, so I always put it on myself. And that kind of makes people a little bit less resistant, because they think that it's because of me, so and I'm okay with that. Because I want them to feel comfortable, and I just want to make sure that they get the information that they need. And I also don't look at, I'm not talking to them, and I tell them, I'm going to be looking at you, and this other person is a tool, not a tool, but it's one of the many resources that I have.
Yes, absolutely. Yeah, I often think that they're grateful when you say, no, we have an interpreter.
Yeah. Teresa, your hand is up.
I have a question, not only to you, but perhaps others. When I was at UCLA, we had a variety of cultures there. And some cultures where the women do not talk, the sons or husbands talk for them. And we were directed to talk to them and not the patient. Well, for those of you who know me, you know how well that went over. But we just kind of had to work around it. And the physician would say, well, you can't use the word cancer, was the radiation oncology department, because they don't, the family doesn't want the patient to know what's going on. And I can remember years ago where a lot of times families didn't want the patient to know what was going on, and they would die from cancer never knowing what was going on with their bodies. And so I think my question is, how did anybody deal with that? I mean, it was really difficult to do. These people were coming in from other countries and paying cash, and so that was just their culture.
It reminds me of when my stepmother found out, when she heard that my dad had cancer. And when we were ready to leave, he went to pick up the car, and I remember saying to her, you need to tell your daughters what's going on. They were teenagers at the time, 13 and 10, I think. And she said, absolutely not, and I said, well, what are you going to tell her? What are you going to tell them? Because he's going to get progressively worse. And you should be, they should be enjoying this time with him, because they're not going to have him. I had him for 35 years, and she said, no, he has a stomach ache. That's what she said to them. And I remember being so angry, and I blurted out to them one day when they were fighting about something that was important to them, but to me, it was meaningless. And I basically told them. So it was the first time, and I felt so awful, because that wasn't about me. It was about what was important to them. And, the consequences they're living with that right now. But at least I think that it's important to have, and that's why interpreter services are so important. And even employee resource groups, if you have any in your organizations, it's important to have cultural brokers that can help you and spiritual care, because they can help you navigate these differences in culture that can help you be supportive to your patients without, without hurting them more, because it's not about us, it's about them. So that is important. So for us to be able to be very clear about our own biases, and being able to have a safe space for you to say, I don't feel, I can't believe it, whatever. You know what? I'm not saying deal with it, but what I'm saying is know what those biases are and find other people that can help you navigate through all these different things that that are happening, so that we can be available, because we have to be available for everybody, not just the patient. We also need to be available for their families. And so these cultural brokers are a great resource that we can have in our organizations to help us navigate through that. But I understand.
Yeah,
And
we
I don't know
find
what was that?
we find at UCLA they finally got to the point where that you had to use an interpreter, whether there was anybody in the room that understood. And I think a lot of that came from the different cultures. But an interesting flip to all of that is my mother died from multiple myeloma, and her oncologist recorded his conversations with her so she could go back and listen, and she could play them to, there were four of us, so we could hear what he said, and nothing was lost in her fear and misunderstanding and not being part of the medical world. So I think it's interesting how different cultures and different practices take place. Some we can't discuss anything. And then the flip was he recorded all of his conversations with her, and it helped. It helped us understand. I mean, I understood it because I was a nurse at the time, but they were, my siblings that had no clue what multiple myeloma was. So,
yeah. And now it's one of the requirements from the Joint Commission that you need to have interpreter services.
Oh, is it?
Yeah.
Good. Yeah.
So, and the recording, how brilliant. Good for that doctor, because I can tell you that I've been a nurse for 27 years, and I literally just had a blank brain. Like my brain was, I didn't hear anything else after you have cancer. And thank God that my husband was there, and he had a list of all the questions that I would have asked. He came prepared, so he wrote it down. So much that I still remember when we went to the second went to the University of Pennsylvania for our second opinion. The doctor kept typing away in the computer, and my husband stopped, he basically said to him, how dare you? You're not looking at us. You need to be looking at us. We deserve better, or whatever. So he stopped and he turned around, and he answered the questions. And I said to him, I am very proud of you. I'm married to a holistic nurse. What else can I possibly say to that doctor? But yeah, it's important to have somebody else there, and to have materials that are culturally appropriate so that they can have them. And also knowing that not everybody can read, and they would never tell you. Sometimes, again, pride. They would never tell you that they don't know how to read, but there's different ways that you can find out whether or not people know how to read or not. So making sure that your materials not only are in different languages, but also have pictures. And there's some people who are not good. They don't capture the information when they're reading it, even if they know how to read. But making sure that, there may be auditory, there may be tactile. So having things that they can touch so they know what it is. all of those things are important. So, part of when we ask questions of our patients, probably one of the most important things that you can ask people is, what is the best way that you learn? Because not everybody is, even if you know how to read, not everybody is a visual person. Other people, I need to see it, I need to hear it, and I'm very, I engage in all ways of knowing. So, people drawing pictures for me to show me where things are, having models and things like that are important to me. Other people prefer to read it, but having things that are culturally appropriate for them to take with them is important. If they have little children, that we probably need to break the news to them, making sure that that is done in a loving way, having spiritual care, or maybe even creative arts therapists that can be there for them, also important. I think we're past our bedtime, Jim.
Well, I got cut off for a second there and came back. So, were there any other questions or comments? Grissel, I want to thank you. We've known each other for a few years now, and it's just always wonderful to hear your stories and to be present with you talking about your nursing journey. It's just beautiful.
Thank you. Thank you. I am a talker, probably because I'm Puerto Rican.
So, all
Yeah.
right. If there aren't any other questions, Grissel, once again, I want to thank you, and I'll send a note to Q and thank him for his part in this. And we wish everybody a wonderful evening. Now, for those on the West Coast, you're just getting into the evening. For those on the East Coast,
5 o'clock.
it's already dark. So have a great night, everybody.
Thank you for joining us for our most recent Conversation Corners. For more information on how you can be part of our Conversation Corners, contact info@ahnCC.org or call 785-267-0943. We hope you will join us in this sacred space to learn more about different people's worldviews and lived experiences. Past presentations that were recorded and upcoming presentation information are available on www.ahncc.org/conversation-corners-2/. Thank you for joining us for our most recent Conversation Corners. For more information on how you can be part of our Conversation Corners, contact info@ahnCC.org or call 785-267-0943. We hope you will join us in this sacred space to learn more about different people's worldviews and lived experiences. Past presentations that were recorded and upcoming presentation information are available on www.ahncc.org/conversation-corners-2/.